My name's Debbie Barker and I'm a senior midwifery lecturer here at Teesside University. Traditionally, midwifery has been with women, where historically midwives look after women during the antenatal, intrapartum and postnatal period and take care of them during that transition through pregnancy and birth. The traditional element of midwifery still feeds throughout the programme, but we now have what we call contemporary midwifery practice, whereby we digress into other areas, and that's been brought about by changes within the 21st century. And some of those changes are driven by research, and some of those changes are driven by high inequalities, and within Teesside we have kind of like pockets of that. So within our units within maternity we have lots of specialist roles, so when students embark upon a midwifery career in midwifery, they have the opportunity to, once qualified, to digress into other areas as well. And the programme within Teesside University, the 3-year pre-reg midwifery programme, kind of supports the development towards that transgression into other areas should midwives choose to diverse. Within midwifery, midwifery is Part 10 of the Register of the Nursing and Midwifery Council. And in 2019 the standards of proficiencies for midwives changed slightly, and our course structure reflects that. So within year 1 we predominantly focus on maintaining healthy pregnancy, childbirth and the postnatal period, and students learn the basic skills of universal midwifery care. In year 2, students then progress throughout the development of the year to prepare them for complex midwifery care, where they will learn complex maternal care and complex neonatal care and the pathophysiology underpinning it, as well as the skills. In year 3, we transition them, getting them ready for practice, so they'll begin their case loading at that point in time. And currently we're undergoing the maternity transformation programme, which is moving towards maternal continuity of care, where women are cared for in specific teams of midwives, and the midwives will come in and deliver those women. So we're just preparing our models and modules and model of care at the minute to reflect that. So it's a transition where we get students in 3rd year ready for clinical decision making, leadership and clinical reasoning in the care that they give for women. So during placement in year 1, predominantly students in year 1 have an awful lot to learn in relation to theory. So there's a large focus in year 1 of students being in university, with shorter bursts out in placement. A lot of units are transpiring to incorporate continuity care. So some units, by kind of like probably 2023, all units will be in the maternity continuity care. So that means that students in year 1 will have a shorter number of weeks in placement, but they'll work in continuity care teams. So it won't be historically like it was before, where you would do a community placement and then a labour ward placement. The two are actually combined. It's kind of like caseloading your own women, where you look after the women during pregnancy, and when they go into labour you're called into the labour ward. So you will work within a shift a couple of on-calls. As you progress into year 2 you do less time in university and more time in practice, and again that gap widens in 3rd year, so you spend less time in university again and more time in practice as we get you ready for the transition to be qualified. So here at Teesside University we're very lucky. We have a specific simulated midwifery lab where we use as the virtual simulation. So we call them kind of like, our ladies call like Victoria and Lucy, but everybody calls them different names really. We have monitors such as resuscitators, we do simulation of fetal hearts, abdominal palpation. We have quite a lot. So when we learn theory and practice, you get the kind of like the underpinning academic theory, and then we support that with the development of a clinical skill. So say for example you were doing the cardiovascular system and adaptations in pregnancy, your next teaching session would be obtaining a blood pressure and doing respiratory rate, because that links directly to the theory that you've had underpinning it, and that follows on right the way throughout. So if we did again the vascular system, or we did immunology or bloods, you would follow that on with venipuncture. The clinical skills that you learn in year one are then applied, because after you do that blocking teaching of kind of like adaptations during pregnancy, you would then apply that within the setting of an antenatal setting when you go into clinics with midwives. Following on from that in year two, you will then progress to complex and abnormalities. So you would learn about abnormalities of the blood pressure and how to manage that in a simulated environment within the classroom, within the midwifery lab. And following on from that, you would then go back out into maybe the labour ward area, where we manage a lot of complexities and a lot of women are admitted, or the antenatal wards. And again, you would apply what you learned in theory in clinical scenarios and then apply that in practice under the indirect supervision of a midwife in year two. So throughout years 1, year 2 and year 3, students are assessed in various ways. They may be assessed in multiple choice exams, they may be assessed in written essays. We perform OSCEs throughout year 1 and year 2, and that is where students are given a clinical scenario and they present back that clinical scenario to us. It's simulated scenario, so it might be, for example, an antenatal visit, a 36-week antenatal visit in the antenatal period with a midwife, and the student would simulate what that visit would entail. We do presentations where students again are asked to look at maybe a complex area within their trust or within Teesside and present that, and that works well within public health agendas sometimes. That's used within the public health models. And the third year is what we call a viva, which isn't a large piece of written work like a thesis. It is a viva where a student picks a topic that is a quite hot topic in maternity at that point in time. So for example, a lot of students at the minute are picking things like induction of labour, hands-off technique for childbirth, and they would look and explain about the evidence that supports that in practice, or whether or not they've come up with any evidence to suggest anything different. And that's a 30-minute conversation between themselves and the assessors. We get students ask us about what is required to be a midwife and what we look for in applicants for midwifery, and it's not kind of like a case of one size fits all, because we look for a multitude of qualities in people. So obviously somebody has to be able to show the ability that they've had the ability to be able to learn academically and be able to demonstrate academic competence in various ways, whether that's through their GCSEs, A-levels, access for health courses. We get a lot of students with access to health courses here at Teesside. They aren't just the qualities that we look for though. Somebody has to be able to be engaging, they have to be able to communicate, they have to be able to demonstrate that they're able to be a team player, because that's very much the focus of maternity care. If you're interested in studying midwifery, we'd love to see you at our open days that are held regularly throughout the year here at Teesside University.